Hi everyone, my name is Med2Med. This video is going to be about aortic dissections, which is a medical emergency where early diagnosis is so important. An aortic dissection is an injury to the innermost layer of the aorta, the media, which forces the layers of the aorta apart and creates a false lumen, allowing blood flow in the wrong part. So you can see in the bottom diagram we have the three layers of the aorta, the adventitia, the media and the intima. In aortic dissection, the blood penetrates the intima and enters the media layer. Typically, the real hallmark symptoms of an aortic dissection are a sudden tearing chest pain that potentially radiates to the back. You may get other symptoms as well that are very similar to a heart attack. They could get severe abdominal pain, a loss of consciousness, feeling cold and clammy, and shortness of breath. But typically, if you hear someone mention this really sudden tearing chest pain that's radiated to their back, always be aware that it could be an aortic dissection. Okay, let's explore what can cause an aortic dissection. It's most associated with hypertension, so having good blood pressure control is a way of preventing this risk. Connective tissue disorders such as Marfan's or Ehlers-Danlos syndrome increases your risk, as do recreational drugs like cocaine and methamphetamine. Smoking is also a modifiable risk factor. Congenital heart defects like a bicuspid aortic valve is found in 7 to 14% of people who have an aortic dissection, so it's a considerable risk factor for one. Turner syndrome puts patients more at risk due to aortic root dilatation. And lastly, chest trauma, either due to blunt trauma or iatrogenic, such as during cardiac catheterization, also puts patients at risk of an aortic dissection. There are two types of common classification methods, the DeBakey classification and the Stanford, which we use more routinely in the UK. In the Stanford classification, there are two types of aortic dissection, depending on where it is located. If it occurs in the ascending aorta and or in the aortic arch, then that is type A. If it occurs in the descending aorta or the arch, that is type B. This is really important because it affects the treatment. All patients with type A thoracic dissection should be considered for surgery, and you should get urgent cardiothoracic advice, whereas type B may be managed medically. How do we manage these patients? Well, it's really important to cross-match 10 units of blood so this is ready in advance. You should do an ECG and a chest X-ray, as well as a CT or transesophageal echocardiography. Take them to ITU and give them antihypertensives. Beta blockers like labetalol are really useful here as well. Lastly, particularly in type A dissections, so remember that's involving the ascending aorta, you should consider surgery. That's really quick, so here's the summary. An aortic dissection is a tear in the tunica media of the aorta that results in a false lumen being created. The most common symptom of an aortic dissection is a sudden tearing chest pain that spreads to the back. The risk factors for an aortic dissection include high blood pressure, connective tissue disorders like Marfan's and EDS, congenital heart defects, smoking, and drug use. Stanford classification splits aortic dissections into two categories. Type A involves the ascending aorta, type B involves the descending aorta. Type A is very serious and commonly needs surgery, but if only medical treatment is required, beta blockers like labetalol are first line. And that's it. Thank you for listening.